Good afternoon. I'd like to call the December 16th, 2024 PDASC meeting to order at 2:02 p.m. Christina, can you please call roll?
Yes, thank you, Lorraine. Renee Bovell. Renee Bovell. Sean Brown. Sean Brown. Okay. Angela Bryant. Angela Bryant. Allison Siborowski. Allison Siborowski. Lorraine Diana. Lorraine, I know you're here. Yep, I see you. Thank you. John Elliott.
Present.
Thank you. Sharita Golden.
Present.
Thank you. Jim Gutman.
Present.
Thank you. Darren Johnson.
I am here.
Thank you. Nishana Kess. Nishana Kess. Greta Kessler. Greta Kessler. Barry Lipsy.
Here.
Thank you. Joey Mattingly. Joey Mattingly. Eric Morse. Eric Morse.
Present.
Thank you. Mark Nicole.
Here.
Thank you. Sean O'Brien.
Present.
Thank you. Haley Park. Haley Park. Mandy Poplowski.
Present.
Thank you. Kimberly Robinson. Kimberly Robinson. Glenn Schneider.
I'm here, thanks.
Thank you. Kelly Schultz.
Present, thank you.
Thank you, Kelly. Sean Tunis.
Yeah, I'm here. Thanks.
Thank you. Joe Wynn.
Good afternoon. I'm here.
Thank you. And Thea Williams. Thea Williams. We have quorum.
All right. Thank you, Christina, for taking the roll, and welcome, and thanks for everyone for joining us today.
Lorraine, you're on mute. I'm sorry.
We're going to move to the motion to approve the November 4th, 2024 meeting minutes. First, we need to approve the last meeting minutes. Do I have a motion to approve the minutes as drafted?
Can I ask a question real quick before we move?
Yes.
Is there a copy of the minutes? I didn't receive any, and there's nothing on the website either. So what are we voting on if we don't have anything?
Mr. Johnson, I sent a copy out on Thursday, the 13th or the 12th.
All right. Can you just resend them to me? I'll have them. I had that question because I didn't have them and they weren't on the website. So if you sent them, if you could just resend them to me, that'd be helpful. Thank you.
Yes, I will send them right now.
This is Sean O'Brien. I'll make the motion.
Thank you. And is there a second?
I'll second Jim Gutman.
Thank you. All approved, say aye.
Aye.
Aye. All opposed, say nay. Minutes are approved. Thank you.
Mr. Johnson, just give me 1 minute because we're about to head into a presentation, and then I'll make sure that you have received that email.
Sure.
Sorry for that inconvenience.
Christina, did we receive any requests for public comment at today's meeting?
Mark, we did not receive any requests for oral public comment, and we also did not receive any written comments to the PDASC for this meeting.
All right, thank you very much. So we'll move to the next item on our agenda, item number 4. So I'll now turn it over to the PDAB staff to give us an update on the upper payment limit and policy review process.
Thank you, Mark. So today we're going to give you a brief update on the upper payment limit process that we have been working through the past few months. To give you a status on the UPL, as many of you know, the board approved the upper payment limit action plan on September 10th at their board meeting. That then went to the Legislative Policy Committee, which approved the UPL action plan on October 22nd. We posted preliminary draft regulations establishing the policy review process, and those were open for public comment until 11/8, and we received numerous amounts of comments on those proposed regulations. The draft proposed regulations were then taken to the board and approved by the board at their last PDAB meeting on November 25th. So the next steps moving forward will be moving forward with those draft proposed regulations through the standard APA process. The draft regulations that we opened for comment were posted on October 28th, as I mentioned in the previous slide. That included amendments to COMAR 14010101, the definitions, new regulation 14010106, the hearing procedures, and then the new chapter COMAR 140105, which is our policy final action and upper payment limits. Those comments, as I mentioned, were due on November 8th, 2024, and we received 16 comment letters. Those were shared with the board and also posted on the website. I'm going to hand it over to Andy to give you a brief summary on the specific comments that we received.
Thanks, Christina. Yeah, so this presentation will likely look familiar. We did have the opportunity to present the original draft regulations to the Stakeholder Council. We did receive some really great comments from the Stakeholder Council and from the public, and we were able to update the regulations. And as Christina pointed out at the on the last slide, this is now going into the formal APA process. So the Stakeholder Council will still have numerous opportunities to provide comment. Today can be one of those opportunities. If anyone has any additional comments that you'd like to bring up today, this is a great forum to kind of introduce that into the record, and the staff can start working with any of that. And then there's also still going to be a separate comment period. So it's going to be posted in the Maryland Register as a proposed regulation. There's going to be a 30-day comment period. Anyone on the council is welcome to submit comments as part of that process. I'll go over all this at the end as well. And then also you should have an intervening Stakeholder Council meeting, which you will also be able to provide feedback. So, as the holidays are coming up, we're not expecting all of your feedback in today's meeting. So do just keep that in mind that you will have other opportunities to provide comment. So we did receive some really robust discussion in our last meeting, which we'll go over, as well as some general comments or some really strong comments through the comment letter process. So one of the overall concerns that it continues to come up basically anytime we open up public comment is just general concerns with upper payment limits as a policy tool. There's also a lot of discussion of the unintended consequences of upper payment limits on things like access, patient cost sharing, and on the supply chain. There's also, there was a lot of feedback just in terms of the process that the board has been following, just ensuring that we do provide enough opportunities for public feedback and input. And then also just general concerns with the specificity of certain definitions, criteria, and steps. And I'll try to walk through each of those in just a moment. What we also find extremely useful is the specific feedback. So anytime we do get specific feedback that we can take, we generally try to take it. So a lot of the things that we received specific feedback on were definitions. So we had specific questions around the definitions of utilization, some questions around the term of an affordability challenge, and then also a lot of discussion around net ingredient costs. And we were able to make some changes based on the feedback that we received. We also received a lot of specific comments, both in the stakeholder council meeting and I believe also in the comment letters, just in terms of the level of detail of our hearing regulations and specific kind of amounts and requirements in those hearing regulations. There was also some questions exactly just on you know, how the APA process is clarified. And then finally, a lot of questions continue to come in on specific steps and opportunities for comment in the actual development of the upper payment limits themselves. So that's at a high level, the different comments that we received. Next slide. As folks will remember, we did have a really good discussion, and I think we will revisit some of these comments today. But in the November 4th meeting, the Stakeholder Council was able to provide feedback on the draft regulation. So hopefully today, folks will be able to just provide comments on any changes that we've made, as well as anything else that you think needs to be addressed as part of these regulations. Main themes included some definitional changes and clarifications, a lot of discussion on the hearing logistics and procedures, also some general timelines for upper payment limits, ensuring that we are meeting consumer expectations or are appropriately setting consumer expectations, a lot of questions around monitoring enforcement, and then also some discussion around the process for suspending upper payment limits. Next slide. So we were able to address all of the updates that we tried to address as many updates as we could. A lot of the comments that we received were not issues that would necessarily be resolved through regulatory language. So when we didn't have changes that we can make in the regulations, we generally kind of left the regulations as is, but we were extremely, we considered all the comments carefully, and I think will have impacts on how we implement different things, but maybe a lot of those comments didn't necessarily require regulatory changes. And then when possible, we tried to incorporate specific feedback and comments. And that is a note to both the public and the stakeholder council members. Through this comment process, including through the APA process, the more specific your comments are, and if you are like recommending proposed changes and things like that, the more specific you are, the more helpful it is, and the more we can try to be responsive to the comments. A lot of things kind of just provide general feedback that you know, certain stakeholders disagree with this idea but don't provide an alternative. Those kinds of feedbacks, we try to address them as much as possible and be responsive, but sometimes there is no response to some of those comments. Next slide. So some of the changes we were able to make between the draft version that you saw and then the version that the board approved to publish as proposed regulations. We updated the definition for purchaser just to provide some general clarifications there. We also had to define the term system net cost. And that comes into a little bit of the discussion later when we talk about what the upper payment limit is. And then also utilization. We updated the definition to clarify that it's what can be represented in utilization, and again, distinguishing it from spending. Next slide. There were also some minor technical changes in the hearing procedures. We did have a lot of really good discussion in our last meeting in terms of where folks would like to see more specified kind of requirements and timelines and things like that. What our concern was with making some of those changes was that it would artificially restrict the board members, and it wouldn't necessarily always help the public in a way if we kind of were overly prescriptive in certain things like timelines and deadlines and different things like that. And just as a general principle, you'll remember that we have a few different ways that we can gather information through different types of hearings. And these regulations are written, you'll see how they're organized, they're actually outside of the UPL process. These are basically the rules that we'll be following anytime we kind of have any kind of hearing procedures, even outside of the upper payment limit process. So they need to be written in a way that provides the flexibility that it can be used in a number of different circumstances, not just for the specific circumstances like folks may be thinking about in terms of kind of UPL hearings. So we did try to get as specific as possible, but we were not able to necessarily make all of the specific changes that were discussed by the Stakeholder Council last time. Next slide. I think the most important and robust change that we made came from a lot of the discussion in the Stakeholder Council last time. Originally, the definition of the upper payment limit was basically the net cost to the payer of the healthcare system. And some of the Stakeholder Council members last time mentioned that it's very important that you actually account for what the patient out-of-pocket cost is too, not just the amount that the eligible governmental entity is paying. So we spent a lot of time kind of thinking through the most appropriate way to account for that. And basically what we ended up doing is setting the upper payment limit amount as the system net ingredient cost. And if you go, remember the definition slide, and you can scroll back to yourself via the references, or maybe Christina can go up after this discussion. We actually are saying that the UPL is the patient out-of-pocket cost plus what the payer is paying. And then the amount, then we created a new term for what the payer is paying. And ultimately, the reason we had to do this was to address basically the discussion from the Stakeholder Council, in that we wanted to make sure that the upper payment, the result of the upper payment limit wasn't just pushing more of the cost share onto the patient, right? What we're trying to do is set what the total net cost of the specified drugs are versus and then make sure that that's accounted for the entire amount that's paid, both the out-of-pocket cost for the patient and the payer. So we spent a lot of time thinking about that. We worked with a number of different teams to kind of think through what that should look like, and ultimately we think we're able to resolve it. But again, what that means is what the board will be setting is the net cost to the healthcare system. It doesn't necessarily specify what the price to the eligible governmental entity will be. That's largely going to be based on their plan design. So we can kind of talk through that. But it is something that came out of the Stakeholder Council conversation, and very much appreciate the feedback on that from the last meeting. Next slide. If you go back to where we were, sorry. A lot of folks were asking us to clarify the criteria that basically states that eligible entities won't set a UPL if there's minimal use of the drug. And we clarified that language to remove the term or reference to minimal use and change it to if the amount that eligible entity spends on the drug is less than what it would cost for the entity to implement an upper payment limit, then they would not be subject to the upper payment limit. So the general idea there, and the principle that we've tried to articulate all along, is basically that there is an administrative cost to building up the processes to implement an upper payment limit. There's generally going to be kind of staff from each of the eligible entities kind of working with us to implement. And if it turns out that the policies and processes and procedures and different work that we need to do to actually implement an upper payment limit costs more than would be saved by implementing an upper payment limit, then the eligible entity would not do so. So that's the general kind of principle that we were trying to get there, and we think we're able to clarify in that definition. And then finally, we just had some additional clarifications around different UPL value calculations. Next slide. So with that, we're happy to open it up for general discussion. Again, we're not expecting all of the Stakeholder Council feedback in this meeting. We just wanted to kind of clarify the changes that we made, largely based on some of the Stakeholder Council feedback and then also the public feedback. And then we're happy to kind of work through or answer any questions that you have here, but there again will be probably at least 2 opportunities for the Stakeholder Council to weigh in on these regulations once they're published. So again, that would be through the formal comment period provided by the APA process. So again, once the proposed rule or regulation is posted, there's a 30-day comment period, and we do encourage folks that have comments to submit comments through that process. And then there should be a Stakeholder Council meeting within those 30 days or around that time period that we should be able to account for before we post the final regulations. I need to double check dates on that. So if nothing else, you will have the opportunity to provide written comment for through the formal APA process. So with that, I think we're happy to open it up for questions and discussion. Go ahead, Mr. Johnson.
Yeah, thanks, Andy. Can you shed any, are you looking to submit this for the Maryland Register for like the early January publication, or when do you believe they'll be in the register for the formal 30 days to start? Do you have any idea?
Yeah, it's been submitted into the process, but that doesn't necessarily set a specific time that it would be in the register, because there's a
Right.
number of different kind of checks throughout the process. So I don't think we have a specific date in mind, but we have kind of started that process. So as long as that process is moving through, I would expect it to be probably some in one of the January registers, if not,
Okay.
after that. But it's kind of out of our hands at this point. Yeah.
Okay, so we're looking, okay, that's helpful. Thank you.
Yeah. Yeah, and I would just kind of echo again. We've gotten great comments, and we're always happy to talk to stakeholders and work through some of the different comments and questions and issues that come up. So if folks do have questions for us, or would like to discuss anything, we're always available as well. Then again, there is the formal comment period once the proposed rules are published. Go ahead, Mr. Tunis, Dr. Tunis.
Yeah, Andy. Thanks. No, this was helpful. I'm wondering just if you could suggest, like obviously there's been a lot of concerns expressed publicly and in various written things about the, unintended consequences or impact of upper payment limits. Do you like have a suggestion about where, what would be the easiest way to find a kind of a distillation of a summary of like what the concerns are, the responses, or are we just going to have to, read through the, go through the kind of the documents that emerge from the administrative procedures process?
Yeah, so we've received a number of letters. So one, when so there was the action plan itself. So there's a few different documents, and folks were able to provide comments throughout, which does kind of understandably make the process complex. There were, so we published the upper payment limit action plan. We received a number of comments for that. The action plan was then submitted to the the Legislative Policy Committee, and the Legislative Policy Committee received their own set of comment letters. And then also now now that we've started publishing the regulations, we've been receiving comments related to the actual regulations themselves. And I would say the themes are consistent. I think the concern I would have is like, we do have kind of working summaries, but I want to make sure that we are not mischaracterizing what the different stakeholders are communicating. And the reason I say that is because a lot of the concerns that are brought up are things that we're not sure that they are actually issues. So the way we're addressing it is, we say we will monitor for these things, but the way that we're proposing that the upper payment limits be implemented. So for example, some of the supply chain issues, we don't picture those to be issues because we don't plan, or we're not proposing that the eligible entities change their reimbursement at this point. It's all going to be done kind of on the back end through the eligible governmental entities. That's how we're proposing it. I think each governmental entity will kind of work with to see how it works with their payment systems and contracts and things like that. But so to that point, we don't see a lot of the concerns with flow throughout the supply chain, and we get a lot of comments on that. Same thing with access to patients. There's a lot of assertions that patients are going to lose access to their drugs if they are subject to upper payment limits without a lot of explanation or justification of how that would happen. So it just makes it very difficult for us to try to respond to it if we don't see that same risk based on how we are proposing that this process work. So a long-winded way of saying, I think you should read each of the letters for their own, and maybe we can kind of flag. A lot of them kind of have the key issues. And it is a lot of the same stakeholders that propose these. So it may be something that we can kind of flag, different stakeholder letters that would be representative. So yeah, and then I can also take it back to the team if there's something that we're comfortable summarizing. It is difficult though to get too into the weeds where we're not exactly sure how they're justifying some of their, or like, what exactly they're trying to articulate with some of the concerns they bring up.
Just one quick follow-on question. Sorry to interrupt. So and you can choose to take this offline or answer later, but is there any reason to think that, the Medicare negotiated prices for drugs, that those, that whatever those are established to be, would have impacts, different from an upper payment limit as it would be applied in Medicare? And if that's not a clear question or a too complicated question, I'm just wondering if we should think about those things any differently, like what, the negotiated Medicare price, which I guess, potentially is going to be mirrored in the upper payment limit. Is there any reason to think that the implications of that are different, when applied through the upper payment limit in Maryland versus, Medicare, other than who's impacted by them?
Yes. So I think I'm tracking the question. So I'll try to respond, and then you can also try to clarify the question itself. So the big thing to note for the maximum fair price is that it is limited to Medicare beneficiaries. So Medicare is setting the price for their beneficiaries, which is a subset of patients in Maryland that we don't think that we would be, our work would likely not apply to. I mean, that's maybe an open question, but ultimately, the state regulates certain healthcare entities, and Medicare is not one of those entities. So that might be something that needs to be fleshed out separately. But so right now, what Medicare is doing is work for Medicare that the state likely otherwise would not be doing. And what we're doing is, work that is specific to our regulated entities. We call them eligible governmental entities, but for our purposes, it's state and local government. Some states also just regulate the entire state market, which again is a different subset of payers. So all to say that right now, the maximum fair price does not apply. When Medicare sets a maximum fair price, as it exists now, it does not apply to the commercial market or our regulated markets. So this is, they're separate.
You would just be applying essentially the same price through the upper payment limit as Medicare, as Maryland patients under Medicare. They would be paying the same as state and local government employees in Maryland if you matched.
Yeah, I don't think our board has gotten to that step in the process. So first, the board needs to identify a drug as, make the preliminary determination that the drug is unaffordable. Then they can implement a process which our regulations are creating. So that process doesn't even exist yet. But as part of that process, we call it the policy review process, and they'll look at everything the state can do to make that prescription drug more affordable for state resident or for Marylanders. And then one of those steps that they can do is set upper payment limits for state and local government. If they decide to do that, sorry, I'm just like walking you through the steps on where we are on this. When they're coming up with what a UPL would be, so after all those other boxes are checked, yes, we want to set an upper payment limit. We think it's an appropriate tool. Then they can set the upper payment limit amount. And the way it's currently structured is that they will be able to look at other prices that exist. So the maximum fair price would be a data point that they would look at when they are setting their UPL. We don't have anything in our policies right now that says that they will just adopt a maximum fair price. I would guess that it would be probably an important data point that they would consider. And then one of the methodologies we talk about is reference pricing, which basically, or index pricing, where you look at existing prices that are already out in the market and potentially use that as a reference, right? So I think there's a way that the board could get there, but I don't think there's anything that says right now that that's kind of where we get to.
Okay, thanks.
Sorry for the long-winded and complex answer. So, Dr. Golden, and then Delegate Carlson?
Yes, so thank you. I think I wanted to follow up on Dr. Tunis's first comment or question a bit. It still seems like there may be some value. I'm thinking about the stakeholder questions where it's unclear kind of what the evidence is that is raising the concerns. It might still be helpful to at least explain perhaps like what you believe the safeguards are based on your analysis to address those concerns. And obviously you always continue to monitor because it's hard to predict what may or may not happen, but it still seems like there might be some value to that because oftentimes, it'll continue to ruminate, without evidence. So if there are particular concerns where you would feel comfortable, that might still be of value. And I think it would help others who might get asked some of those same questions. So everybody's speaking the same language about that.
That's a great point, and we appreciate that. And I think that's something we've talked about it, like maybe even just like a public facing Q&A of like, what is this? How will it affect me? That kind of thing. That's a great idea and something that we can look at putting forward just so everyone has, the responses to all those questions. Thank you. And Vice Chair Collison?
Sorry, having trouble getting to my unmute. Thank you, Andy. And actually, Dr. Golden just said much of what I was going to say, because I think it's important for us to make sure that people know that we have considered this. And I appreciate how thoughtful both the board and the stakeholder council have been in this process and developing the process. And anytime, and I'm now speaking as a policymaker from 60,000 feet, that anytime we try something new and innovative, there are always going to be concerns about how it upsets the status quo and what will happen if the status quo is changed. And, I can honestly say in the 15 years that I've served now in the House of Delegates, I've heard that argument often whenever we bring an innovative solution to the table. And not once have I seen a case where the negative consequences made us change our policy. Sometimes we had to make minor adjustments based on experience. But I think, there's a history, first of all, in terms of the deliberation that this process has taken, that shows we're ready in terms of the monitoring and all the guardrails we've put in place, as Dr. Golden said, to guard against those negative impacts. So thank you for letting me speak from that perspective.
Great, thank you, Dolly. So yeah, we can certainly do that, and we have carefully considered this, and it is one of those things where the board has clearly said that their intention is to increase access. So if there any work has any kind of risk to that, that's something they would very carefully consider. So, but yeah, we'll look at trying to put together a kind of a public facing document that you can kind of share with your patient that can kind of explain some of these issues that they come up. Mr. Johnson. You're still on mute. I'm not sure if you're.
Oh, sorry about that. Question about the eligible government entities that you've been in contact with. Can you elaborate a little bit more on, like, if you've been in contact with all 23 counties plus the city? I mean, who are you touching base with, at least initially, around the subject matter? Or have you?
Yes, we've been reaching out to all the governmental entities that we believe fit within the statute, and a lot of that outreach kind of starts with folks kind of at the folks that administer the employee health plans, basically. So yeah, I think we've reached out to every eligible county. Municipal governments are also included, so it's a pretty extensive list. And as we've talked about before, we expect that the first set of UPLs would be with governmental entities that we're actively working with, just to make sure that we're fitting within how they administer their health plans. So we are working very closely with those entities, and then we also do expect that the regulations would state which of the governmental entities the UPL would apply to. So that is something that will be kind of fleshed out in the regulation, or articulated in the regulations themselves. When we find, if we publish a regulation that sets UPL, it would articulate the eligible governmental entities it applies to. So short answer to your question is we are reaching out to every entity that we believe is an eligible governmental entity.
Okay, thanks.
Yep. And we also welcome folks to reach out to us as well. So if there's folks that have not heard from us and believe they're an eligible governmental entity, we maybe just be talking to a different part of the government, as can happen. So if folks are interested in our work and believe that we can help them with their work, please reach out to us and we would love to work with you. So. All right. So we did expect this to be a shorter presentation, and we do expect this to be kind of a step in the conversation. So this certainly isn't the end. And we do, especially with our stakeholder council members in particular, we're always happy to kind of set calls with you and work through any specific issues. We are very lucky to have very informed and technical stakeholder council members, and we're always happy to kind of work through technical issues with you. That goes for the public as well. If any feedback you have, we welcome it, and we're happy to work with you. I think, Christina, am I next up on this too? Oh, go ahead. Chair Leary, or Chair
Andy,
Mayor?
I was going to thank you for your wonderful presentation and also all the comments that were made. They were excellent. Would you like to now give us an update on the cost review study process?
Yeah, no, so the next agenda item is just an update on the cost review study process. So I think folks that listened in on the board meeting will hear a similar update. The staff has collected all of the information for the cost review study process, the first cost review study process. We implemented the request for information. We did receive some very good responses. The two documents that we expect to publish first are going to be for the two SGLT2 drugs, the Farxiga and Jardiance. We haven't published that information yet, but it's something that we're actively working to publish. And we do want to have something available publicly before it goes before the board. It may be published as board materials, but we will notify the stakeholder council members as soon as there's something published that we can react to. So again, the intention is to kind of publish all the information that we can that is responsive to the different regulatory elements for the cost review study process. And as soon as we expect these two drugs to be the first ones that we will publish on. The next ones that we're working on are Ozempic and Trulicity. Both of those drugs are also well within the process. So those documents may be posted shortly afterwards. And then after the documents are posted, we then expect to do the request for information for the two outstanding drugs. So all of this should be happening through early 2025. Again, just as a reminder, the next step is for the board to review the data that we're presenting to them. We call the kind of the format that we'll be publishing. They're sharing that information with the board members. We call that the dossier. So that's a document that we expect to publish. One thing that we wanted to flag is that we don't expect to have different versions of documents. There is going to be confidential proprietary information that is limited to the board members, but we're hoping to do as much as possible in a single document and then just redact public versions. This is something that could change, but right now we do want the public to kind of see everything that the board sees while redacting and removing anything that's confidential proprietary. One thing to also note for these two drugs in particular, and one thing that we were thinking about bringing before the stakeholder council today is folks may remember that we continue to receive a lot of comments on appropriate therapeutic alternatives for drugs. And one thing that we do think we're doing, just the way the document is starting to shape up, is for all the diabetes drugs, we included all drugs that were within kind of the similar step of therapy if you follow clinical guidelines. Our clinicians on the line probably understand how complex the guidelines for diabetes can be. So one of the things that the document is currently doing is when we talk about therapeutic alternatives for Farxiga and Jardiance, limiting it to the SGLT2s when we say the most direct comparable therapeutic alternatives. So that is something that was kind of an open issue, and I'm not sure if it's necessarily going to be a policy that applies to all the different classes. But for now, we do expect that when we're doing our framing, we'll still share all of the information, all of the therapeutic alternatives that we publish. And again, it's a pretty extensive list on a number of different therapeutic classes. But we will try to kind of frame it in terms of prioritizing the comparison across the SGLT2 class. So that's the main update that we have for everyone. Yeah, so I think, all to say that we will have a pretty busy 2025. And we do expect this information to be kind of published on the website before it's presented to the board, potentially as board materials, but we will make sure that the stakeholder council is notified as soon as any of that information is available. So I think those are our main updates on the cost review study process. I see Mr. Johnson coming off mute. Go ahead, Christina.
Dr. Golden,
sorry.
her hand raised.
Yes. Thank you. Sorry,
first.
Dr. Golden.
No, no problem. Yeah, I was gonna say, I'm glad to see that that change was made, because the guidelines are complex and often, in addition, the equivalency within the class, it also depends upon what comorbidities, a patient has. So what may be the next drug for one, patient with diabetes may not be the same for a different one who has heart disease and chronic kidney disease. So that also influences choices within class. So
Very
I'm glad
helpful.
to see that change was made.
Great, thank you. Mr. Johnson?
Thanks, Andy. I have a question from the board meeting. You may recall Dr. Anderson asked a question about when the board members receive information, and some of it might be proprietary, confidential, whatever. I think he was asking, can he ask additional questions of the information, or can there be sort of a back and forth? I don't know. I think you said you were going to look into that a little bit more. Do you have any further sort of thoughts on, I guess I'll just call them from the audience, follow-up questions that maybe he was inquiring about, but I was just curious if there was any further deliberation from his question at the board meeting.
It's a good question, and we don't have any additional guidance. I think what we said in the meeting is the way that we are currently providing this information is to the board members. So it's something that they can consider, but not necessarily something that they would further flesh out. And I think we're still considering if there's ways that we can try to get additional information from folks that have submitted data. If it goes beyond so this is all for the cost review study process.
Right.
I think if they make the preliminary determination that based on the data that's available, the drugs have led or will lead to affordability challenges, then there's additional mechanisms to work more directly with the manufacturers as well. So I understand from the manufacturer's perspective, they probably want to get that information to the board and answer any questions as soon as possible. So we will look for that opportunity.
Thank you.
It looks like there are no more questions. So Christina, will you give us a quick administrative update?
Yes, thank you, Lorraine. The next board meeting will be taking place on January 27th, 2024 at 2:00 p.m. This meeting is planning on being virtual due to the legislative session. So I just wanted to make everyone aware of that. The board's meeting virtually in January. And also the 2025 PDASC meeting dates are posted on the website, and I did send calendar holds for those dates for all of our PDASC members. So thank you.
Christine, I
then-
might have one additional thing to add, if that's okay. Sorry.
Oh, I wanted to say one more thing. I'm sorry. That's
Yeah,
okay.
after you, I'm sorry.
And the board and PDAB staff would also like to thank the PDASC for all of your hard work this year and dedication. We've moved a lot of important work forward, and your feedback was really an integral part of that. So, I just wanted to say thank you to everyone, and we wanted to say thank you to everyone. So thank you very much. And I don't know if Andy wants to add to that.
Yeah, I'm sorry, I interrupted at the worst possible time. I would just echo Christina's point that we very much appreciate what the board or the stakeholder council has done. And just as we come to the end of the year, it is also like just a generally nice time of reflection and seeing if there's anything else that, any ways that we should be kind of changing our work moving forward. And we've been thinking a lot about how to use such a great group of experts that we have. I don't think we have hard recommendations yet, but I did just want to flag that, as we're coming into the new year, we are looking at ways to make sure that we're getting the best use of the stakeholder council and making sure that all of this work is worth your time as well. So if anyone does have any feedback, feel free to reach out to us or the co-chairs, and we'll keep you updated as we move forward.
Thank you, Andy and Christina. Thank you, everyone, for your time and feedback today. Oh, Christina, sorry, Glenn has.
Yeah, Glenn has his hand up.
I'm sorry. I just want to make one more comment. I want to thank everybody as well. This has been a great year of work of the entire process. I really appreciate it all. I just wanted to say there's a new article that came out in JAMA that talked about the high prices of prescription drugs. And while we think about what we're doing now for state and local governments, which I think is absolutely terrific, I just can't wait for the time period where we can get this available for everybody else. So really looking forward to what we can do, not only in our process here, but generally to reduce prescription drug prices, not only for state and local government employees, but also for the rest of the public. So I look forward when we can get that part done.
Thank you, Glenn.
And hello,
Mr. Gutman?
this is Nishana.
Oh, hi, Nishana. Thank you for joining us.
Sorry, I'm on the phone, so I can't see anything. And I can't use my hands. I was trying to jump in there because I was listening in, and I just wanted to add a little bit. So did you want to go to the next person and come back?
Yes, Mr. Gutman was next, and then I can take you next if that's okay.
Okay, thank you.
Yeah, thank you.
My point is just
Okay,
a quick
no problem.
note, thanking the board for this meticulous and thorough approach, which does, as Glenn says, set us up for the next step, which is in everybody's best interest in having this extended to the general population. I realize there are things to go before that, but hopefully in the legislature next year, they will aim that based on how well this board has set the stage for it. Thank you.
Thank you, Mr. Gutman. Ms. Kess, you're next.
Hold on. All right, thank you. Hello, everyone. So what I wanted to add to the conversation about extending the prescription affordability to individuals, the NAACP, we have a resolution that's been sitting since 2019 supporting prescription affordability for all. That includes every citizen as well. So we're certainly on board with this effort.
Thank you. Thank you for that information. We appreciate it.
No problem.
Mr. O'Brien?
Thank you. Yeah, just like to say is, my union represents many of the workers who are covered by the current law, but we also very much support extending it to cover others as well.
Thank you. Okay, before I let Lorraine go, I want to make sure there's no more hands. Andy, we have a board member, Dr. Rockauer, who raised his hand.
Yeah, I think you can let, yep, Dr. Rockauer is available. Yep. Go ahead, Dr. Rockauer.
Yeah, hi. I just want to thank the Stakeholder Council and the staff for all their hard work this year. This has been a long slog to get to where how far we've come. And I think we're doing a great job, and we need to keep working into the next year and beyond. Thank you all, and happy holidays, and we'll see you next year.
Thank you, Dr. Rockauer. Okay, I don't think I see any more hands. Just want to confirm.
Thank you, Christina.
Thank you.
I don't see them either. So thank you, everyone, for your time and feedback today, and for all the wonderful comments that you've made. The next PDASC meeting will take place on Monday, February 24th, 2025 at 2:00 p.m. The PDASC is planning on remaining virtual throughout 2025. We'd like to wish you all very happy holidays and see you in the new year. Do I have a motion to adjourn?
So moved.
Thank you. And a second?
Second.
Thank you. So thank you all again very much, and we're adjourned.